We'll be talking a lot about breast cancer this month in recognition of Breast Cancer Awareness Month happening in October. And today we're focusing on breast reconstruction for cancer patients.
We welcome Dr. Gregory Swank with Piedmont Plastic Surgery and Dermatology. Dr. Swank, so good to have you back.
Hi, thanks for having me today. As you mentioned, October is Breast Cancer Awareness Month. October 15th is Breast Reconstruction Awareness Day. That's Bra Day.
Well, thank you for wearing your pink tie, too.
Sure, of course.
Where do we begin, then? You want to start by talking about breast reconstruction and what it is that you do?
Sure. Well, breast reconstruction involves utilizing a variety of plastic surgical techniques to rebuild or reconstruct a natural-looking breast that has similar size and shape to an appearance of a natural breast. There are several different techniques that we use to do breast reconstruction.
Yeah, talk about the different types of breast reconstruction surgeries.
Yeah, there are different techniques that we can use. We can use a woman's own tissue to rebuild a breast. That tissue can come from the abdomen or the back or even the buttock to help restore a new breast. We also use tissue expanders and implants to reconstruct a breast, or we can use a combination of both autologous tissue and implants to reconstruct the breast.
What's the benefit to using a woman's tissue?
Different techniques allow for different appearances of the breast. Using your own tissue can actually create a breast that moves a little bit more naturally than an implant would.
Oh. Now, where would you have this surgery performed? In an office, or would you have to go to a hospital setting?
No, the surgery is typically performed in a hospital, and depending on the type of reconstruction being performed, it can involve a several-day hospital stay.
Who is a good candidate for this?
Almost any woman who is undergoing mastectomy for cancer or even prophylaxis. They should be in good overall health, and of course your doctors would help determine what type of reconstruction you would need to undergo depending on any underlying health conditions.
You mentioned the mastectomy. Can you perform the reconstruction at the same time as the mastectomy?
Yes, indeed, and we call that immediate reconstruction. The process begins right at the time of mastectomy. We can also do what we call delayed reconstruction, and that means we begin the reconstructive process any time after the mastectomy has been done. That could be months or even years afterward.
What can a woman expect after the surgery? What is the recovery like?
After the surgery, we're going to create a new breast. The breast may not move and it may not have the same sensation as a natural breast, so they need to be aware of that going into the surgery. The reconstructive process can take several operations, and I like to tell people it can take a full year from start to finish before we really see the final result.
And the final result, how do women feel about that? Because I can imagine there is a mental aspect to the reconstruction as well.
Yeah, there sure is. And breast reconstruction is really great. It helps to improve patients' self-esteem. It helps them feel more feminine. And it also takes their focus off of the fact that they have breast cancer, and they can really focus on the reconstructive process and becoming whole again after mastectomy.
To learn more, call Piedmont Plastic Surgery and Dermatology. The number is 828-325-9849, 828-325-9849, or visit them online at ppsd.com, ppsd.com. And remember that as a convenience, you can submit your patient forms online prior to your appointment. Saves you a lot of time when you get to the office. Dr. Swank, thank you so much for being here today.
Thank you. We appreciate it.